C in brackets. Placing the cement and seating the veneers. Underline. New paragraph. An extremely critical part of how long your veneers will last comes down to how the veneers are cemented and seated onto the tooth at the fit stage. Full stop. You can have done the best assessment and the best tooth preparation and ordered the best porcelain veneers in the universe, but the stage of actually fitting them is one of the most crucial. Full stop. This is because a veneer will fit in a certain precise way and there cannot be any shortcuts whatsoever. Full stop. Once a veneer has been placed on your tooth and the luting, L-U-T-I-N-G, cement has set, that is it, and there is no returning or the procedure cannot be reversed. Full stop. Many dentists, especially those not very experienced, will either not be familiar with the exact technique of fitting veneers, or they will rush the procedure. Full stop. If this step is not done properly, the veneer will not be in its intended position, and also there will be excess veneer cement in between the teeth, which makes it impossible or difficult for the patient to floss between their teeth afterwards. Full stop. In fact, one of the most common mistakes that I see as a dentist is excess cement in between the teeth, which means that the patient cannot floss easily. Full stop. This creates a food and plaque trap, which is unpleasant, smelly, and creates gum disease together with dental decay. Full stop. New paragraph. D in brackets. Curing the luting veneer cement. Underline. Once a veneer has been placed on the tooth and the glue is on, the glue needs to be hardened. Full stop. The hardening process of the glue is by way of a dental curing, C-U-R-I-N-G, light. Full stop. If the curing light is not very powerful, or the curing has not been carried out for a sufficient length of time, there will be unset dental cement which can lead to the veneer breaking or falling off. Full stop. It is important also to know that it is the dentist and his dental nurse's job to make sure that the area where the veneers will go, are as dry as absolutely possible. Full stop. This is because any moisture or bleeding or gingival fluid, will contaminate the resin cement on the veneer, and the veneer will eventually fail, or it will leak, causing decay underneath it to develop. Full stop. D, new paragraph. D brackets flossing around the veneers, underline. As mentioned above already, it is extremely crucial that when the veneers are placed on the tooth, that floss does indeed go through all the contact points of the teeth. Full stop. New paragraph. Number 2, patient factors, underline. As mentioned above, the most, by far the important factor which determines how long the veneers will last comes down to the dentist's assessment and skill in preparing and fitting the veneers. Full stop. However, that is not to say that the patient does not have any influence on how long a veneer will last. Full stop. Veneers are definitely not as strong as your natural tooth, or even a tooth which has had a full crown over it. Full stop. This means that veneers are always vulnerable to breaking or chipping. Full stop. You need to be aware that any hard objects or chewing not carefully or biting into something, can cause veneers to fracture. Full stop. So as a patient, you need to be conscious all the time that you don't accidentally bite into anything that may damage the veneer. Full stop. On the other hand, normal day-to-day foods such as a sandwich, soft bread, and cooked foods are definitely something that you can eat without placing the veneers at risk of breaking or chipping. Full stop. New paragraph. It is important that dental porcelain veneers are looked after at least as well as your own natural teeth, full stop. This means brushing them twice a day and paying particular attention along the gum line, full stop. If any bleeding or sensitivity should ever occur, you need to get this examined by your dentist as soon as possible, full stop. New paragraph. Your diet is very important as well as cleaning the veneers, full stop. All veneers definitely need to be flossed at least once a day, even if you don't floss any of your other natural teeth, full stop. New paragraph. Other patient factors which influence how long your veneers will last include para-functioning habits such as bruxism, bruxism, or clenching, full stop. Bruxism and clenching creates huge stresses on teeth, and veneers will break if they are subject to these forces, full stop. Although bruxism and clenching are unconscious habits, the dentist can make you a protective night guard to wear in order to reduce the risk of your veneers chipping or breaking, full stop. New paragraph. Number 3. General wear and tear, underline. So far we have talked about how veneers can last and are influenced by the dentist's skills and patient factors, full stop. However, dental porcelain veneers are never going to be as strong as the original veneers, i.e. your own natural enamel that you were born with, full stop. After a time, veneers can become discolored, especially around the gum line, where gum shrinkage can also occur, full stop. In addition, veneers can wear and chip over a period of time, full stop. Usually you can expect 10 to 15 years out of your veneers. However, there are many studies which show that there is a large variation in how long veneers will last, full stop. In some studies, veneers only lasted 5 years, and there is a large variation in success rates, with success rates as low as 70% over 5 years, full stop. New paragraph. replacement veneers, underline. When or if you need a veneer or veneers replacing, there are additional risks that you need to be aware of, full stop. A veneer has the best and longest chance of survival when it is the first veneer, full stop. This is because when a veneer is replaced, usually more enamel needs to be removed during the process of taking off the old veneer and taking off the old luting cement, full stop. This means that a replacement veneer will never be as strong as the original veneer that it replaced, full stop. Quite often, a replacement veneer is not even possible anymore, and a crown has to be carried out, full stop. Whenever a veneer is replaced, it increases the chances of the nerve or the pulp of the tooth becoming necrotic, necrotic, full stop. New paragraph. Conclusion, underline. To answer the question, inverted commas, how long do veneers last, ? Close inverted commas, we can say for certain that at some point the veneers will need to be replaced and they will not last forever, full stop. Veneers can fail for lots of reasons, so you could have 10 veneers in your mouth and one comes off at a frequent basis almost soon after you had it done, and you may have other problems with other veneers as time goes on, full stop. The conclusion is that, you need to be absolutely certain that a dental veneer is the right choice of treatment for you, and you know the implications of it as well, full stop.